Hello, welcome to the presentation on sudden cardiac arrest, automated external defibrillators, referred to as an AED throughout this presentation, and stop the bleed kits. My name is Michelle Staker, and before I begin, I want to thank you for your role in keeping our students and staff safe and healthy. I speak for all the school nurses when I say, we truly cannot manage without the help and support from each and every one of you. Each Raleigh County building has an AED and stop the bleed kit mounted on a wall. Large buildings will have multiple devices. Please learn the location of the devices in your buildings. I'm going to discuss AEDs, but I want to begin with a brief explanation of sudden cardiac arrest. Sudden cardiac arrest is the reason we have AEDs in our buildings. Understanding sudden cardiac arrest will help us understand the need for quick treatment to increase the chances of survival. What is sudden cardiac arrest? Sudden cardiac arrest is an electrical problem in the heart that prevents the heart from pumping blood to the brain and vital organs. The electrical problem causes an irregular heart rhythm. This heart rhythm is not life-sustaining and death will occur rapidly. This is what a normal heart rhythm would look like on an EKG. When we discuss shockable rhythms and the need for an AED, we are talking about ventricular tachycardia and ventricular fibrillation. You can look at these two rhythms and see that they are not life-sustaining. They are very chaotic. Those rhythms originate in the lower portion of your heart called the ventricles. What might cause sudden cardiac arrest? Coronary artery disease, a heart attack, an enlarged heart, valvular heart disease, congenital heart disease, which is a disease you are born with, an electrical conduction problem, illegal drug use, trauma to the chest at just the wrong time, which is referred to as commotio cordis. You may have heard of an athlete such as a baseball player who was killed during a game when he was hit by a baseball. And also electrical shock can cause cardiac arrest. Sudden cardiac arrest is different than a heart attack. A heart attack is a plumbing problem with a blockage, but it can lead to an electrical conduction problem. Symptoms of sudden cardiac arrest are usually immediate and drastic. There's no pulse, there's no breathing, and there's a loss of consciousness. However, there may be a brief period of vague symptoms prior to those. They could include fatigue, fainting, dizziness, chest pain, shortness of breath, and palpitations, which is an irregular heartbeat that you notice. Treatment for sudden cardiac arrest includes early defibrillation with the AED. We're going to talk about what is an AED, where they are located, when to use them, and who may use them. In addition, CPR is a treatment that will be discussed. What is an AED? An AED is a medical device that can analyze the heart's rhythm and, if indicated, deliver an electrical shock or defibrillation to help restore the heart to an effective rhythm. The two rhythms that the AED is looking for are those ventricular rhythms that are chaotic. Location. Know the location of the AEDs in your school and community. Remember, large buildings will have multiple locations. They are also located throughout our community. Your church, your gym, the areas that you shop may also have AEDs. Be familiar with their locations. When to use them. You use an AED when there is a collapsed, unresponsive person. I must stress they have to be unresponsive. If they're complaining of chest pain or heart attack symptoms but they're still alert, you would not use the AED. Who may use the AED? Anyone may take the AED from the cabinet to the side of an unresponsive person. The Good Samaritan Law, which is a law that protects non-medical individuals who offer assistance to those in need of medical care, protect you from litigation. How to use the AED. You're going to determine if the patient is unresponsive and not breathing. Next, you're going to call 911. If there is a trained individual, you can start CPR, and you're going to have the AED brought to the scene. If you are alone and the patient is an adult, you will actually go get the AED before you start CPR. If it is a child, you will do 2 minutes or 5 cycles of CPR, which is 30 compressions and 2 breaths. The reason for this is an adult that is collapsed is probably in sudden cardiac arrest. If a child collapses, their initial problem is probably related to their respiratory system, their breathing, and therefore we need to start CPR first. Next, you're going to open the lid and follow the voice prompts. You're going to remove clothing if necessary, and you're going to dry or shave the individual. If they're hairy, you can shave them. The AEDs have a razor in a side pouch. In addition, there's gauze to dry them. If they're in a puddle of water, they would need to be moved. You need to determine if the adult or pediatric pads will be needed. This needs to be done quickly. If they are under the age of 8 or 55 pounds, you'll use the pediatric pads, which are located in the back pocket of the AED case. The adult pads are already connected to the device. You're going to follow the voice prompts and pictures on the package for pad placement. The AED will analyze the rhythm and will advise you to stand away from the patient and not to touch them. If a shock is advised, the AED will remind you to stand clear of the patient again and not touch the patient. The reason you cannot touch the patient is 1, it can analyze your rhythm, and 2, you do not want to receive the shock. Once the shock is delivered, the AED will advise you that it is now safe to touch the patient and will initiate the CPR cycle, 30 compressions and 2 breaths. You will continue this until help arrives or the patient becomes responsive. Know your part in the chain of survival. As I said earlier, we cannot do our jobs without the help of everyone. Early recognition and calling for help increases the chance of survival by 5%. If you add CPR, it increases the chance of survival by 10%. If you add the AED, early defibrillation increases the chance of survival by 75% if administered within 10 minutes of time of collapse. That is why we have the AEDs in our schools and in our community. 10 minutes is not a very large window to respond when we have to have the AED brought from an external source, such as an emergency responders. Again, 75% chance of survival is significant. Please think about ways you can help a victim of sudden cardiac arrest. We are in the process of getting the Powerheart G5 Aeds in our schools. It is the newest models, and they are on order and will be in place this school year. This video is a demonstration of how they will work.
Cardiac science introduces a new breed of AED that combines ease of use, reliability, and advanced patient care to help experienced and first-time rescuers give a victim of sudden cardiac arrest the best chance of a favorable outcome. Sudden cardiac arrest can strike anyone without warning. But a victim may survive if treated with a defibrillator within minutes to restore the heart to its normal rhythm. That's why cardiac science designed the new Powerheart G5 Aed to enable almost anyone to act quickly and confidently to save a life. The Powerheart G5 is the first AED that combines real-time CPR feedback, fast shock times, and variable escalating energy. This rugged AED has an IP55 rating, medical-grade battery, and customizable settings to match the skills and preferences of the user. The Powerheart G5 is easy to see from a distance. The highly visible green indicator confirms that the AED has passed rigorous daily, weekly and monthly self-tests and is ready to perform a rescue. Operation is intuitive from the start, with immediate voice and text prompts.
Stay calm. Follow these instructions.
Set the G5 to give extensive prompts for lay rescuers or fewer prompts for experienced users. You can even switch to an alternate language with the touch of a button. The pads go in either position, so there's no guesswork. The G5 analyzes the patient's heart rhythm and determines if a shock is needed. The fully automatic AED even delivers the shock with no human intervention and no delays. The CPR device guides you on the rate and depth of compressions according to the latest resuscitation guidelines or your preferred settings. The G5 determines if a second shock is needed and automatically escalates the energy. It is the first AED that can quickly deliver this higher energy shock, typically in 10 seconds or less. After the rescue, professional responders can easily transfer rescue data via USB. Cardiac Science backs the Powerheart G5 with responsive local support and a 7-year warranty. Now here's a demonstration of the G5 in action. When you open the G5, you'll immediately hear,
Make sure emergency services are called now. Begin by exposing patient's bare chest. Remove white square package from lid of AED. Tear open white package across dotted line and remove pads. Peel one of the white pads completely from blue plastic. Firmly place the pad without the blue plastic on the patient. Next, peel second white pad from blue plastic. Firmly place the second pad on the other location exactly as shown on pads. Do not touch the patient. Analyzing heart rhythm, please wait. Shock advised. Do not touch the patient. Shock will be delivered in 3, 2, 1. Shock delivered. It is now safe to touch the patient. Give CPR as instructed. Remove green square package from lid of AED. Tear open green package and remove CPR device. Place CPR device on center of patient's chest between nipples. Place heel of one hand on CPR device. Place heel of other hand directly on top of first hand. Lean over patient with elbows straight. Start CPR. Press, 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 press. Press harder and fully release. Give breath. Give breath.
once the CPR cycle is complete, the G5 analyzes the heart rhythm and delivers additional therapy if necessary. With a combination of advanced features you won't find in other AEDs, the Powerheart G5 can help professional and first-time rescuers make the difference between life and death. For a demonstration of the amazing new Powerheart G5, contact your local cardiac science team.
Next, we're going to discuss Stop the Bleed. We have a video from Cindy Stark that provides details about using the Stop the Bleed kits. These kits are for mass casualty situations. They are not for just basic first aid. Please watch this next video.
Hello, I'm Cindy Stark, school nurse with Raleigh County Schools. Welcome to Stop the Bleed Fast. These slides have been assembled from a full training for laypersons to introduce accepted strategies and available equipment to use in a life-threatening bleeding emergency. While this presentation does not qualify as a full training, the techniques may be used for injuries that may occur while at home, at work, at school, or in leisure activities while outdoors or at a sporting event. These organizations have been actively participating in the development of the awareness campaign launched in 2015. Stop the Bleed encourages bystanders to become trained, equipped, and empowered to help in a bleeding emergency until help arrives. Why would someone need this training? Someone severely bleeding can bleed to death in as little as 5 minutes. Quick response improves the chances for the person experiencing bleeding. The number one cause of preventable death after injury is bleeding. The focus of this program is the immediate response to bleeding. Everyone should know how to recognize life-threatening bleeding. To identify, first, second, to stop the bleed. Steps to stop bleeding: pressure, packing, and applying tourniquets. Your personal safety is your first priority. If you are injured, you can't help others. If your situation changes or it becomes unsafe, stop, move to safety, take the victim with you. Wear gloves. Avoid direct contact with blood and body fluids on skin, eyes, or mouth. Wash hands even if blood is not visible. Clean any area that touches blood. Tell a health provider that you got blood on you and follow their instructions. Alert 911. The dispatcher will guide the conversation. Know your location. If you are using a cell phone, the tower may not pinpoint where you are. Stay on the line if possible and give a callback number. As you can see, this bystander carefully looking before touching. There's bleeding. They see it. For bleeding, the source of bleeding may have more than one. Bleeding may be continuous or pulsing like a sprinkler or pool around the person. There may be multiple places where someone is bleeding. Clothing may hide life-threatening bleeding. Bleeding control. Bleeding from the extremities, arms and legs, and bleeding from juncture areas where the extremities join the body, the neck, the armpit, the groin, where large blood vessels are located. External bleeding from these areas are the focus of this program. Bleeding from the trunk, which is contained within the body internally, is not the focus of this program. This individual needs to be transported quickly to medical care. Pressure. Notice this person now has a barrier between them and the actual injury. Direct pressure with hands. Applying direct pressure to the wound with just enough gauze or cloth to cover it until help arrives. In a large, deep wound, surface pressure will not control bleeding effectively. Pack this wound with gauze, then apply surface pressure. Here's a demonstration of packing a wound. They remove the gauze. They find it's a deep wound. Of course, you would want to be wearing gloves if you were actually packing a wound for protection from blood. Notice they're packing it deeply within the wound to apply direct pressure to the blood vessels inside the wound. They continue to pack it until they have the opportunity to provide direct pressure on the surface. A third method of applying pressure to a bleeding wound on an extremity is a tourniquet. A tourniquet is applied above the injury, above the wound. It is not placed over a joint, an elbow or knee. It's tightened until bleeding stops. Tourniquets are not removed in the field, but only under medical supervision once the person has arrived in trauma care. Here is a demonstration of the application of a tourniquet on an extremity. Applied above the elbow, the end is slipped through the buckle, firmly placed around the extremity, fastened to itself, and then tightened with the windlass, which functions to increase the force of the compression to stop bleeding. The time is marked clearly on the tourniquet when it was applied. The goals of this program were to recognize life-threatening bleeding and take the appropriate steps to control bleeding until help arrives. With this training, you can save lives. For more information, please go to stopthebleed.org. Stop the Bleed kits are located in cabinets just beneath the AED in each building. Alarm cabinets are not locked. Inside, bleeding control pack contains multiple kits. Each kit is vacuum packed, has instructions, and contains a tourniquet, gloves, that's the blue, a quick clot dressing, a trauma dressing, and a marker to write on the tourniquet. Each location has a bleeding control pack with multiple kits. There are 8 kits in each pack. They can be taken individually to the locations where they would be needed. I truly hope that this has been helpful. Remember, alert 911 to get help on the way. Identify bleeding, control bleeding with direct pressure with hands, packing the wound, or using a tourniquet. Thank you.
Here is a picture of the Stop the Bleed kit and the AED, which is located at the board office. This is what you will see throughout the buildings in Raleigh County. They might be stacked or they might be side by side. There is a door alarm when you open the door. If the door does not alarm, it just means the battery could have died. If it does alarm, it's just an alarm that someone has opened the door. It is not wired into any type of emergency services. 911 still needs to be called. If you want to look at these kits closer, please get with your school nurse. She would be glad to open the cases and show you what's inside and give you a better look at these devices. If the door alarms when you open it for an emergency, do not worry. Someone can come behind you. There is a key that will turn the alarm off located inside of the mounted cases. It is our hope from Raleigh County School Nurses that this information today is just information. We hope that you never have to use the AED or the Stop the Bleed kit for any situations within our buildings. If you have any questions, please contact your school nurse. Thank you.